Fred Rogers of Mr. Rogers' Neighborhood fame, wow, that's dating me, but yes, I grew up on the show, has a famous quote. When I was a boy and I would see scary things in the news, my mother would say to me, "Look for the helpers. You will always find people who are helping." Oh, I always get a little teary eyed when I think of that quote. But having a loved one at the end of life or being in a terminal diagnosis yourself and facing death can be a scary thing. I know when my mom was dying, I constantly looked for the helpers, the nurses who administered care, the cafeteria worker who gave me a warm smile, the valet who made sure to get my car first. We don't always see the helpers either. A lot of times they're behind the scenes, helping. Well, our guest today is one such helper. Jen Ferguson is a San Antonio hospice social worker, a helper for families who are facing grief and bereavement due to the terminal diagnosis of their beloved family member. And she's going to talk to me today about what exactly a hospice social worker does and why she feels drawn to be such a helper in so many ways in her life. Welcome to Before You Go, the official podcast of Abode Contemplative Care for the Dying. At Abode, our mission is that we live in a world where death is not feared, and we live fully until we die. And we'd like to make that happen before we go. I'm Natalie Buster, yoga, volunteer, and doula director at Abode in San Antonio, Texas. Welcome to Before You Go. Hi, Jen.
Hi, Natalie. Thank you for having me.
Oh my goodness, thank you so much for taking time out of your incredibly busy schedule, as our viewers and our listeners will soon find out, to talk with me today.
I've been looking forward to this.
Good. Yeah, I think it's so important for people to demystify hospice in general, and then secondary to demystify the role of a social worker. We hear about social workers in different fields. And I'm curious if you could describe a little bit about what a social worker does in the hospice environment.
Oh gosh, how much time do you have, Natalie? We do a little bit of everything. Patients come on to service, and sometimes they've known their loved one is sick. And sometimes they come on and they've been told their loved one has like 6 months or less. So it's just really meeting with the family where they're at and just assessing kind of how accepting they are of it. It's interesting. It's really interesting to see the progression through, because we make monthly visits until they get closer. It's really interesting to see the progression of the family's acceptance of their loved one, and just sometimes they're a bit more accepting. I have a couple families right now that are very, very much in denial, and you're kind of navigating how to to get them there. Um, I had one family that she just recently passed, the mom and the son, the one son that was pretty much her primary caregiver. He was having a hard time, and we thought, oh, he's gonna have a really hard time. But when she passed, it was just a peaceful, very peaceful. He had mariachi singers the night before, and it was just I think that cemented having that tradition, having that to celebrate their culture. So it's just really interesting to see families, the progression, and just be there really in the moment with them.
Oh, yeah. I love that you said you meet them where they are. And I can imagine that every single family you touch is so different. Like you can't just have your toolkit and go, I'm going to use this for everybody.
Oh no, family dynamics are so complicated, and I've had families where lots of support, and end of life, it's just a lot of support, a lot of love. I've had families where there's a lot of estrangement, a lot of trauma, and grief. Grief is an interesting monster. It brings up a lot of things that get buried over the years. So it's really no family is the same. No family is the same. And even in some families, I kind of meet families similar to my own, and you can kind of parallel those dynamics, and it's interesting. It's really interesting. It's never boring.
Oh, I can imagine. Do you see a trend in how people are accepting or not accepting death and dying? I know for a long time, and probably still in our culture, it's kind of a taboo subject to talk about. Have you seen that in your work, or do you see a change starting to happen?
I do see a little bit of I do see a little change. And it's interesting culturally too. I think some families are like have things planned out, like when I go and make that initial visit, they've got like the DNR already, or they're ready to sign the DNR.
And for our friends, what is a DNR? Not everyone knows what a DNR is.
So it's out of hospital, do not resuscitate. It's basically just a piece of paper that either the patient signs, or if they're not able to, they come on for dementia or cognitive deficits, their family member or somebody can sign for them, and then be notarized, or two witnesses, and then the doctor signs off. And it's just a piece of paper just signaling that they don't want to be resuscitated if the heart stops or they stop breathing, till just the more natural way to go. And that's it's interesting conversations to have with families. But and then just asking about the funeral home, because part of our when they do pass, the hospice nurse that will pronounce the patient, they do call the funeral home. So a lot of times I either get a mixed bag, like, oh, we already have a funeral home, we're going to use this, or sometimes we don't want to talk about it at all. And usually with those families, I explain why we need the name of the funeral home, and then I kind of make a note of it, and I'm like, okay, next time I go, kind of see where we're at. So sometimes it takes a couple months to move forward with that conversation, and sometimes, but yeah, it is interesting because I do bring up the death doula program a lot, which I know we are in close contact about. And it's interesting because when I bring it up, I, I'm like, there's a birth doula, and then they have what's called death doulas, and people kind of give me a side eye. And then I kind of will go like, well, I mean, like, and I like to say like end of life navigator, because I think it's a bit more easier for the people to digest. But then a lot of times they're really curious, and it's kind of, I don't know if fun is the good right word, but it's kind of fun to explain to people what that is, and just that added support and added resource for families at the end of life.
Yeah, I want our listeners and viewers to know just how close Jen Ferguson and I are. I swear you contact me more than my husband. With I get a lot of texts and a lot of calls about clients that you're working with who you think could benefit from one of our abode trained end of life doulas.
Yeah,
And you're really helping us to spread the word about the good that can come from hiring or bringing on an end of life doula. So I really appreciate that.
you're like BFF in my phone, Natalie.
I know, I'm like, oh, it's Jen Ferguson again. All right, let's get the doulas ready.
Well, yeah,
Um,
no, and you've been
but it
great.
is nice. Yeah, it's an added service. And I feel like as a social worker, you're also helping to these families find these resources that they may not know about.
Yeah, I think like honestly, like 90% of my job is really listening and just being there for the family. Sometimes we sit there. A lot of my visits, especially kind of once we get the DNR sign, we get the name of the funeral home, kind of get those. Most of my visits is just sitting with the family and just checking in with them, and how are you doing, and I need help with this paperwork, Jen, or I need respite, which is a hospice benefit where for our home patients, they go to a nursing home for 5 nights and kind of give the caregiver a break. So a lot of it, like 90% really is just sitting there and listening. and just kind of being a source of resources and help for the family. Yeah, and sharing stories. I love when families share stories with me.
You probably really get to know them, and I can imagine that after a while, you're almost like a part of the family as well.
Yes, very, very much so. It's a very, I don't, we don't always, or sometimes the team doesn't always get invited to like the service. But when we do, it's such an honor, such a huge honor, because they don't have to. I can don't definitely be family and friends, but the fact that they think of us, of that, and my family member that I recently passed that had the mariachi singers, her son was just very, just, you're welcome to join that with us, Jen. And it's just an honor. It really, I don't think people realize how much of an honor it is to be in these homes and be with people in such this intimate, very sensitive time in their life.
Oh, that's so beautiful. It is an honor, and that's something that we're very aware of at Abode too, with just being a part of this really sacred and special time for the person who is dying and also their friends and family. So I want viewers and listeners to know how you spend a day. Like, kind of walk us through a typical day as a hospice social worker.
So we have a morning call that we jump on, like all the nurses, social worker, chaplains. We jump on a morning call, and we go over any deaths that happen, people, any changes. Sometimes our after hours will, say so and so is going to be on dailies because of decline.
And what are dailies?
Dailies is when they are transitioning. So a lot of times they kind of, as the body shuts down, they're in that, they're not eating, they're sleeping, they're not engaged. It's just really, really, it could be days, it could be weeks that the body's shutting down. And so I try to see at least a couple times that week. They're already getting daily nursing visits at that point. And then usually the aide goes 2 to 3 times a week still. So they're still getting the hospice present. So I try to go like 1 to 2 times a week, really based off what my families need. And I always tell them, like, if you don't want to visit from me, I get it. Sometimes I don't even want to see myself. It's fine. Like, you're not going to hurt my feelings. I'm all about like what is best for the family. So we hear that. And sometimes my day just, I'm like, oh, this person needs this done. And so and new admissions too. That's a really, because we only have like a 5-day window that we are able to go meet the family and do our assessment, unless the family wants us later. But we have, and sometimes I have patients that come on and they're kind of already transitioning. So I usually make that my priority. But yeah, usually I will make a set up my I usually set up my visits like a week prior, so I kind of already have it planned of who I'm going to see. But yeah, I listen to that call. Get on that call, and then sometimes that dictates. If nothing, then I go about, you know, seeing facility patients. But yeah, I try to see like 4 to 5 patients a day. Sometimes it's like a couple home patients, a couple facility patients. If I know someone is needing respite, I'll meet with them, or if families reach out to me and are like, "Can we talk about placement, Jen?" I'll schedule a visit in with them that day or the next day.
Yeah, well, one of my favorite things is when you can find time in between visiting 4 to 5 people a day to pop into Abode because you've had a lot of your clients or your patients come stay with us.
I love Abode. I love Abode. I cannot say when I talk about Abode to families, like I get goosebumps, and I tell them, I'm like, please just go see it because I cannot do it justice. And I would joke with Mary a lot often, just sprinkle me
Yeah.
in the back there. It's so serene.
It's so beautiful. And anyone in San Antonio, if you haven't been to Abode, come on by. We'll give you a tour. It's a feeling. It's a place, but it's also a feeling.
It is, and I think one of the things, well, there's so many great things about Abode, but I really harp on with my families is, not only will they love on your loved one, but they'll love on you, and you don't have kind of this strict when you're in a facility, these strict visiting hours, and you're in a private room and everything is very private and personable, and the kitchen, it's a house, it's that home atmosphere. So yeah, I usually, when I talk about the death doula program, I tie in abode. I'm like, basically what they do at abode, they'll come to the home. But yeah, I get giddy whenever I get a message that you've accepted one of our, I get giddy.
Yeah, it's a magical place, I'm telling
I was
you.
just gonna say it's magical. It's really magical.
So Jen, I am curious about how you first got interested in helping people at the end of life. I mean, what what did it take? Did something happen in your life, or what led you to be a helper?
I grew up with a nurse mom. My mom was, I always joke with people that we weren't a religious family, but I always joke with people that I was raised by Jesus without, without Jesus, without going to church, without the Bible, without that religious presence. But my mom was just this amazing, caring, giving woman, and she really instilled in me and my brother. He was a police detective for many years, and then I became a social worker. But it's funny because she went into nursing to do labor and delivery, and she found after her like 10th baby and her rotation, she was like, I'm good. And then she found oncology, and worked as an oncology nurse after nursing school for a couple years. And she said she really found like that part of life really, there was just something about it. And I would joke with her and be like, "You're so weird, mom." And then fast forward to she's passed, and that's probably part of, we lost her almost 18 years ago to cancer, and she was on hospice. So I definitely had that personal experience with hospice, and then getting ready to move to California and care for my grandmother who was on hospice. I care for her full time. So I think just having that influence in my life. And then when I got my degree, I did some mental health, worked at the nursing home, and and then started hospice. And I've been doing hospice going on 5 years, and I love it. Like, I love it. It is, I know I can do other things in social work, but I love it. There's something so rewarding. There's just something magical about, and I definitely, it's one of those, hospice I feel is like definitely one of those professions where it's like it's a calling. Like you have to have a passion for it. You really do.
So you come from a family of helpers. I mean, that's pretty spectacular. I wonder if you can share with us a story about how your work has benefited others, maybe like what you brought to a family or someone at the end of life.
Probably just my bubbly hot mess self. um, I think families just a lot of times just need that smiley, like kind of happy, I'm gonna love you and I'm gonna be here for you, and that encouragement.
Yeah, I mean, I feel it every time you come in the doors at Abode. It's like this bubble of energy, just this explosion of good good intentions and happiness. And I think that is there's a common misconception that hospice is incredibly sad and depressing, and it's not.
It has its moments for sure, but and it's funny when I tell people, like, I do, when they ask me what I do for a living, and I tell them I'm a hospice social worker, and they're like, "Oh, that's so sad." And you're like, "Yeah," I nod my head, and like it's definitely, but I get to meet the coolest people, and I get to hear their stories, and I get married couples that have been married like 60 plus years and see their dedication to each other, and they really take that in sickness and in health line vow seriously to the end, literally. It's really, honestly, it's really inspiring. For me, I do have moments. I think when I visited that family that had the singers recently, and they had all this family in the room that had come to see her, and she did pass that following morning. But you definitely have moments of that. But for the most part, it's just so, and I think what people don't realize is that a lot of our patients have been sick for so long. And a lot of times they're sick with cancer, and the watching someone die from cancer is horrific. It just eats up the body, and their quality of life. A lot of times they're bedbound, and they have to have be changed, and fed, and everything needs they need help with everything, and so their quality of life is not the best, and so it's almost like a relief when they do go, just because they're so sick, and it's hard on families. I see the stress of how are we going to care, and how are we going to provide, like.
I think it's important for people to hear this, that it is normal to have those feelings of relief, and that you probably see that. And I'm sure you also see that compounded grief or guilt about feeling
Oh yeah.
relief.
Oh yeah.
We can really do a number on ourselves. We can really beat ourselves up. But I think listeners of this podcast can go, "Oh, yeah, it's okay to feel those feelings."
Yeah, no, it's normal. It's normal. I know when my mom passed away, there was feelings of that. She had cancer. That's what she passed away from. So what my mom was this vivacious, like independent, you know, woman, and so it's really debilitating. So by the end, it is a relief, and I see that on my families.
Yeah, and helping to normalize that, and letting them know it's okay.
Yeah, no, and that's part of like when I go in these like daily we call them code green visits. Maybe other hospices have different names for the daily visits, but when I go in, letting your loved one know that you're okay, they're okay, they'll be okay, you're gonna be okay, reassuring them.
What would you say that doing this work, how has this work helped you in your life? Like, what has it taught you about what's truly important? Has it changed how you approach your life?
Oh, yes, for sure. I think when you work with death on a daily basis, like nothing is certain. I've had patients come on and been like, oh, they'll be with us for a couple months, you know, and then like Monday dial in and they pass over the weekend, or having patients that you're like, oh, they might go this weekend probably. I'll be surprised if they're not if they don't pass, because they're so ill, and then they're still with us months later. Like it is nothing's for certain, but death is for certain, and it's definitely taught me. I know as cliche as it sounds, to just really enjoy every minute, really take advantage of every opportunity, I guess, and get your affairs in order. I think that's
Don't wait.
yeah, yeah. I have adult children, and I've expressed like, if I'm ever on hospice to sign, I want to be a DNR. If I can't voice that, things like that, telling them what I want, my wishes, because that gets sticky when you start having those conversations and you're like, mom didn't express, or we don't know. And so they're already scrambling with their grief, and then trying to make the best decisions for their loved one or honor their wishes.
Yeah, it's such good advice, because I think people in our society, we it's kind of taboo to talk about death and dying. So a lot of times people then don't prepare for death and dying. And like you said, that leaves a tremendous burden for the people who are left behind. I mean, they're struggling with their own grief and bereavement, plus they have to make decisions on top of that. So I feel like it's the biggest gift, the biggest love letter that you can give your loved ones are those wishes, those preparations.
No, that's like the perfect way, Natalie, to like it's a love letter to your family. Yeah, yeah, yeah. We had it's funny, I really don't remember. I was like 27 when my mom passed, and I had young kids. My kids were 2 and 4 when she passed. So, but I don't remember having like conversations like with my mom about what she wanted. I just knew she was going to be cremated. She was from born and raised in Scotland. She came over here when she was 13, and me and my dad and my brother took her ashes back we flew back to Scotland several months after. We had like a celebration of her life. And but yeah, I don't remember having those conversations. I mean, maybe we did. I can barely remember, sometimes 5 minutes ago. So that was, but I just remember like knowing she was going to be cremated, and we had a celebration.
And that helped probably, knowing what she wanted.
Yeah, and I think just this gathering of her ashes was just was like 2 weeks away from my kids, my young kids, which was bittersweet. It was a nice break from them. And then it was fun to be. I hadn't seen my family in Scotland for years, so it was fun to catch up and be with everybody. And it was a bittersweet sweet time. But no, but knowing that we brought her back to where she was from, and honored her in that way.
And she, in a sense, brought you all together too. You got to see people you hadn't seen for a while, and that's such a special gift.
Yeah, she's still bringing family together 18 years.
That's great. Jen, what is the one thing that you wish people knew about hospice?
That it's just love. It's just love, especially at those end time, those last couple of months, last weeks, days even. It's just love. Yeah, and I'm fortunate to witness working with people that, I have some really good nurses. I've worked with some really good nurses, and just watching them just love on the patients and make sure they're comfortable. And it's love. It's love and compassion. It's that helper, like Mr.
It's that
Rogers.
helper.
It's that
Yeah.
helper. It's that helper. It's just being present.
What is one way that you're filling your cup?
I have a really good little group of friends, but spending time with them really. Me and my best friends, we like literally have a weekly, like end of the week, we'll meet like for happy hour, like, and we'll have a couple drinks like at the end of the week with friends. I just recently went to Disneyland at Christmas time in December with my brother and his family, and that was fun. Riding those roller coasters at 45 is not for the faint of heart. I thought I needed a chiropractor when I got back. Probably still do.
Jen, one last question before you go. What do you want to do before you go?
I just think continuing to just spread awareness about hospice, um, and go to the beach as much as I can.
I like that. I think before I go, I will join you for a walk on the beach.
Well, you're welcome to
I'll come
visit.
out and visit.
I would love that, Natalie.
Oh, Jen, thank you so much for taking time to chat with me today. I know our listeners are just going to love this interview
Oh,
just as much as I love you.
thank you, Natalie. Like, thank you. Likewise, I just adore you, and what you do, and just you as a person. And thank you for having me. I really appreciate it.
This episode is brought to you by Abode's Death Cafe. Our objective is to increase awareness of death with a view to helping people make the most of their finite lives. To learn more about Death Cafe, go to abodehome.org. Oh my goodness, wasn't Jen a hoot? When I first asked her about doing this podcast, I asked her for her email address, and she was like, Jen is a hot mess at yahoo.com. It's not really her address, but it's just so funny that she brings all of this wonderful kind of explosive energy. And that's how she is in real life, folks. It's not just here on the podcast. But she also is just someone who feels deeply. And I think when I first met her at Abode, she just had this way about her. I saw her with her clients. I saw the way that she interacted with them. And I'm like, my goodness, what a helper. What an amazing person. And what she said about hospice, like, it's love. It's such an honor to watch the nurses loving on these people at the end of life. It's such an honor to be able to love on these family members and help them navigate the sacred time. And it's just the more hospice workers I meet, nurses and social workers, chaplains, CNAs, volunteers, people who work in death care, I mean, they get it, right? They get what life is all about. And so my big takeaway is just what she said, walk the beach, do all of the things, make sure you have all of your affairs in order, but also live your life to the fullest because death is inevitable. That's one thing we know for sure. So why not make the most of it now and just immerse yourself in love? So before I go, I promised Jen that I was going to walk the beach with her. So I'm going to go out to San Diego and walk the beach with her. But I'm also just going to remember that it's all about love. That's what it's all about. Nothing more, nothing less, just love. Thank you for joining us for this episode of Before You Go, the official podcast of Abode Contemplative Care for the Dying. At Abode, we believe death is not a medical event, and we are not medical professionals. We're just sharing our opinions, and these opinions shouldn't be taken as medical advice. You can find us online on Instagram, Facebook, and YouTube. This episode was edited by Make Your Day Richer.